Liposuction is one of the most common procedures we do as plastic surgeons. It's safe, it's effective, and it is a procedure that's been improved over the last 10 to 15 years. What is it? Well, it's basically a way to remove fat that is resistant to diet and exercise, that genetically you're predisposed to. For instance, in a male, let's say the flanks or the sides of the abdomen, or in a female, perhaps the thighs or the neck or many other areas such as the arms. So how does it work? Well, a small incision, probably the length of a small fingernail, is made in the skin. And then if that is the muscle and that is the skin, a small incision is made in the skin, a small tube or a cannula is placed through the incision, and the fat is reduced. So the fat pocket goes from, let's say, this width down to a very small level. And you have to leave some fat cells so everything looks smooth. And so that's the way fat is removed, and usually it's permanent. In other words, the fat cells are gone forever. There's the idea that the fat will come back. Myth number one is that fat will come back. Well, fat cells are finite. There's only so many the body has, so when you've reduced them, the ones that are left can get slightly larger, but you're not going to manufacture more. So the area that you treat is permanently improved. The second myth that comes about based on that is, well, the fat will go elsewhere. It'll come to another area of the body because I removed it from, let's say, the abdomen. And the reality is that if you looked at yourself 5 or 10 years later, the abdomen that you treated is probably much better than it would have been had you not treated it, obviously, but you don't recognize that other areas of the body, like, let's say, the thighs or the arms, have continued to age normally, and you haven't removed fat, and so those areas can enlarge based on genetics and aging and weight gain. So you think logically that the fat has gone to those areas, even though they would have looked that way anyway, and the abdomen still looks better. And I think the third myth is that, well, you can do all this with exercise. Well, the reality is this procedure wouldn't exist because there's so many people who are dedicated to exercise and diet, they would simply be able to accomplish that. The reality is that the reason the procedure works so well is that there's not really another way to get rid of this area that is so resistant to diet and exercise.